Now we're going to go into chapter 2 about knowing your numbers. This is the book called The $1,000,000 Practice Formula. So early in my career, I had a strange realization. I could tell you about anatomy of the foot with incredible detail. I could explain the biomechanics of plantar fasciitis. But if you ask me a simple question, what's your average visit value? I had absolutely no idea. And the truth is, most doctors don't. We're trained to understand medicine, but not math. But private practice is a math question. If you don't know the equation, you can't control the outcome. The moment I started tracking a few key numbers each month, I suddenly understood why some weeks felt busy and unproductive, and others were very productive. And that's when I realized the math to $1,000,000 wasn't mysterious, it was measurable. One of the biggest mistakes I made earlier in my career was not tracking my numbers. I looked at production just once a year at tax time with my accountant, which is exactly what most doctors do. The problem with that approach is obvious. If you only check the scoreboard once a year, you have no idea whether you're winning or losing during the game. So I came up with a rule called the $80,000 rule, or the 80K rule. If you want to produce $1,000,000 per year, your monthly target becomes $80,000, which means your weekly target becomes roughly $20,000. Once I started thinking this way, everything changed. Instead of hoping the year would turn out well, I began monitoring progress every week and every month. So the numbers that matter. Every day, I have a little piece of paper that I track 4 numbers. Okay, I track the number of patients I see. So on the top of this tracking sheet, it has the date, and it has an underline with a dash 25, because I tend to focus on 25 as my kind of vital number for the day, for each day. Some days I may see more, some days I may see less, so I'll put in 21 or 23 or 24 off 25. The second number I look at is my most valuable patient of the day. So throughout the day, I write down my most valuable patients, the patients that produce the largest revenue. And many times those would be my orthotic patients, those would be patients with Lipizzaner, those would be patients that I'm setting up a package of shockwave therapy, like 6 sessions of shockwave for plantar fasciitis, and then doing an amniotic stem cell injection at the second visit, and then doing a orthotic at the third visit. So these would be my packages. That's my MVP, and then I also document and record any high-value treatments, as I mentioned before, orthotics, but also if I do a collagen for a wound, or if I do an AFO. And then I also put in there procedures. I like to focus on those procedures. So these numbers can tell me exactly how the practice is performing. The procedures would be like lesion destruction, cantharidin, Swift, shockwave, flexor tenotomies, exostectomies, different type of procedures. Now, it'll tell me how the practice is doing, but more importantly, they show where improvements are possible. And so if I recommended 10 treatment plans and 6 started, my acceptance rate would be about 60%. So I like to put in who accepted my treatment plans, meaning these packages of shockwave and these packages of treatments, but that I usually put a little frowning face of those that didn't. But I'm proud of myself that I offered it. I think in the beginning it was a struggle to get no from patients, but really we have to learn how to offer. And one of my biggest tips, I'll probably get into this later on, is I always start with what's best. So when I'm talking to a patient about plantar fasciitis, for example, which is an easy one that we all see, when I see them, I'll go over the X-rays. I'll start my initial treatment. Usually, it's going to be with a night splint, foam rolling, morning stretch, some anti-inflammatories, some icing, and then if we're not getting better at the next visit, I'll do an ultrasound, and then I'll say, okay, and the best treatment for this, based on your ultrasound, is going to be 6 sessions of shockwave, an amniotic stem cell at the second visit, and then an orthotic at the third visit, so this doesn't come back. So I always go over best with them first, and then if you want to do less, you can tell me. So I kind of leave it on them for doing less. So a simple habit that I found is at the end of each day, I ask myself a little, I call it a filtering question. Did I practice like $1,000,000 doctor today? And this leads to powerful reflection, and sometimes the answer is yes, and sometimes the answer is no. But that reflection creates improvement. Some days I realize, well, I was just way too tired and didn't drink enough coffee, or I stayed up late the day before and I wasn't on. There are other days where I let the busyness of the day allow me not to be totally present. There's some days I just get distracted working on other things, and I didn't give the patients the time that they needed. Okay, so my second mistake was when I first started tracking numbers, I noticed something uncomfortable. Many patient visits were extremely low value. I'm not saying that the patients were low value people. I'm not saying that, but I'm saying clinically, patients were leaving with minimal treatment plans. I was not offering everything that I had to offer them. And the old way, what I used to do is I used to start from the bottom up. So let me just repeat this because I think this bears repeating. Now I say, okay, the best treatment is this. Okay, the best treatment is the shockwave, is the amnio, is the orthotics. That's the best treatment. What I used to do is I said, well, let's try these things first. Like, let's try stretching and over-the-counter inserts, and then if that doesn't get better, then we'll go to the next treatment, then we'll go to the next treatment. Same thing with warts. Let's try cantharidin first, and if that doesn't work, then we'll go Swift later. So now we start with, let's try Swift. Swift is the best treatment. Laser is the safest treatment because there's no side effects whatsoever. And then if that doesn't work, then we can go down to the oral medication. So starting with the best always allowed me to come down. Whereas in the past, I used to always start really low, and once they were used to that I guess that nothingness or only doing what insurance covered, they didn't really want to do any of the other treatments. Same thing with prefab inserts versus custom orthotics. Always starting if it's medically appropriate for your patients with the customs, but then if they say they don't want to do that or they can't do that, then you could go down to a prefab. Okay, so patients were leaving with a minimal treatment plan, like stretching instructions or shoe advice, and at the follow-up, if it doesn't get better, then I would offer other types of treatments. So those visits weren't helping patients as much as I could, and they were certainly not helping the practice grow. That realization led me to one of the most important discoveries in the growth of my podiatry practice, the concept of the most valuable patient. And that's what we're going to go over in this next chapter. So I hope you guys found this beneficial, this chapter about knowing your numbers. I think this is very important. If you want my daily tracking sheet that I use in the practice, just shoot me an email, don@podiatrypracticemastery.com. I'll be happy to send you mine out. I have to confess, I had the idea in the past, but since I had a scribe, it makes me a lot easier. I can write these things down. Before I had a scribe, it was really hard to track these things because I was just so busy just doing the notes and just pushing my way through. But I find that being more deliberate and writing these things down on my tracking sheet, and this is actually most of my ideas for my podcast come from my daily tracking of the patients that I'm seeing, what level visit they are, what are the most valuable types of treatments that I give them. So in the next episode here, we're going to go over the most valuable patient. If you want to get the whole PDF download of this book, you can go to podiatrypracticemastery.com/book, and you can download the PDF if you don't want to listen to this whole thing. But you might like listening because I add some little tidbits as we're recording this.